In other news, at least half of the South African adult population is believed to be obese or overweight. Weight loss surgery is gaining popularity around the country as more sustainable solution for shedding some extra kilos. Our business reporter, Ntokozo Khumalo, explores the world of bariatric surgery as a medical solution to obesity and what people should consider before going under the knife.
South Africa faces a growing obesity crisis. 3 out of 10 men and 6 out of 10 women are overweight or obese. 49-year-old Tanya Dudley from Atlantis in Cape Town has struggled to manage her weight since childhood.
Before, I wouldn't really go out. I wouldn't go and visit family. If I do go visit family or go out, even taking the kids somewhere, it was always a problem.
HR professional Sharon Andrews from Melrose Arch in Johannesburg shares Dudley's sentiments, despite only starting to pile on the kilos after the birth of her second child.
It didn't matter what I ate, it didn't matter if I exercised, it really just had no impact at all. It completely changed who I was as a person because I was completely unhappy with myself.
After years of trying and failing at different weight loss methods, both opted for bariatric surgery as a last resort. Dudley, at 155 kilograms, needed knee surgery due to excess weight, while Andrews, at 97 kilos, wanted to manage diabetes. Recommended for those with a body mass index from 35 to over 40, there are 2 main types of bariatric surgeries in South Africa. Dudley had a gastric bypass surgery, which makes a small pouch in the upper stomach and connects it to the small intestine, reducing food capacity. Andrews chose laparoscopic sleeve gastrectomy, removing most of the stomach to leave a small pouch.
It is about the size of a banana, and it is about the capacity of a banana. And that is how much you can eat. And so the way that you lose weight is basically you eat so much less that the body has to obtain the rest of its calories that it needs from the fat or the calories that had been stored in fat in the body, and that's why you lose weight.
Costing anything between 40 and 160,000 rand, Dr. Thenia Smith, a bariatric surgeon at the Zuid-Afrikaanse Hospital in Pretoria, says Andrews and Dudley are sadly part of the few benefiting from bariatric surgery, 35 years after it became available in South Africa.
We've probably operated about 8,000 patients in South Africa. Out of people, if you look at people who actually qualify, it's about 20 million.
Several factors impact the cost of bariatric surgery in the country, including private healthcare and medical aids, considering it a cosmetic procedure, therefore not covering it. Several medical experts, like bariatric dietitian Nicola Drabel, are also essential for the surgery's long-term success.
Is to try get patients out of a diet mentality. And this is really, really difficult. So we start doing those type of things, getting them to eat regular meals. There's also a misconception that people living with obesity are well nourished, but in actual fact, a lot of them are malnourished.
This means the possibility of taking lots of supplements made up of vitamins and minerals, as well as closely monitoring your meals for years after the surgery, which calls for mental grit. Fisher Wellness Hospital in-house clinical psychologist Dr. Mashudu Maliva adds that this makes regular chats with the therapist important. Socio-economic hardships such as the rising cost of living and stagnating income levels also weigh on people's mental health, compounding weight issues.
When you are depressed, you don't feel like eating. Sometimes people just sleep. They won't eat. They won't even give thought to what they are putting on their plates. Or sometimes they binge eat. And when they binge eat, it really increases, their weight gain.
Dr. Potgieter says it will be interesting to see how the industry shifts in the next few years and access improves. This after a Lancet commission called for obesity to be defined clinically as an illness like other chronic diseases or medical specialities. He says there is no reason more people should not have access to the procedure, as it has a 30% lower risk factor than more complex surgeries such as a heart bypass, and is also safer than some of the other everyday surgeries such as hip or knee replacements and gallstone operations.
A hip replacement operation or a knee replacement operation or a gallbladder operation for gallstones, it carries a mortality rate of 0.2 to 0.3%, which is 2 to 3 in 1,000, which is exactly the same risk of the lower end bariatric operations. That is your sleeve gastrectomy, your gastric bypass, your lap band procedure. When you do the more advanced operations, the risk goes up a bit to a level of 0.09, which is 9 in 1,000.
The return on investment is also worth it, according to Dr. Smith, due to the surgery removing the future cost of obesity.
Most patients, we generally see that they get the money back that they spend after about 3 to 5 years. You know, if somebody has severe obesity, we'll probably get the money back within 3 years.
As part of efforts to improve access to information and resources around bariatric surgery, Dr. Smith and other surgeons are working on the Obesity Community Fund. The fund will also raise funds to those who need but cannot afford the surgery. Despite obesity care only gaining traction in South Africa about 5 years ago, he is encouraged that there are now 4 hospitals around the country specializing in bariatric surgery.
Obesity is not a problem that's going to go away, so it's going to cost us a lot of money if we don't do something about it.
Society think it's an easy way out. It is absolutely not an easy way out, and it takes a lot of hard work and a lot of dedication in order to make it a success.
We need to look at their psychological side, we need to look at their social side, their spiritual side as well, and their financial side. It's very important because all these factors, they connect. If one of them is not functioning, it will impact on how well this person will be able to manage their obesity.
For Dudley and Andrews, the surgery gave them a new lease on life.
Till today, no issues with the knee. Nothing whatsoever. No issues. There's nothing. There's no more pain. Since losing the weight, I haven't had any issues with my knee.
For Newzroom Afrika on Channel 405, I'm Ntokozo Khumalo in Pretoria.